the whole issue of doctors being pressured to do abortions. Well, I do have some experience in that because my wife is a physician and she's an obstetrician. Now, she did not perform abortions. And when she was in her training years ago, the residents, the trainee physicians could take the option not to train or perform abortions, and that's the track she chose, so she did not do that. Some of her colleagues did. So over the years, what my wife saw in practice of obstetrics until she retired was this sort of push for more and more testing. We want to test, and in prenatal testing, it's wonderful. Don't mistake what I'm saying. But in a lot of cases, some of this testing is to detect things to signal people to consider aborting their babies, and that was always very distressing for my wife. And now my wife has been retired for a number of years, but just the colleagues that we know who are still in active practice, they're feeling that pressure even more acutely in this day and age, because so much of this testing, while it will detect these anomalies, then once you get a positive test, you go, well, now do I abort my child? And that seems to be, in a lot of cases, the reason the testing is even required or requested. I want to know this so I can abort my baby in case it's not perfect. I'm glad my parents didn't have that option, because I'm certainly not perfect. But that's where a lot of the genetic testing is a platform to give people the option. And the pressure that some physicians who are pro-life feel is that there are some of these legal mandates that are starting to be talked about, where if a child is born and it has a defect of any kind, then the doctor is liable because the doctor didn't offer the option for abortion. So it puts pro-life physicians in a very precarious situation.